Welcome to Corporate Warrior, the podcast that brings you the best advice on how to improve your health, optimize performance, and maximize productivity. With your host, Lawrence Neal.
This episode is brought to you by ARX, the most innovative, efficient, and effective all-in-one exercise machines I have ever seen. I was really impressed with my ARX workout. The intensity and adaptive resistance was unlike anything I've ever experienced. I love how the machine enables you to increase the negative load to fatigue target muscles more quickly, and I love how the workouts are effortlessly quantified. The software tracks maximum force output, rate of work, total amount of work done, and more in front of you on screen, allowing you to compete with your previous performance to give you and your clients real-time motivation. The ARX uses a computer-controlled motor to give you the exact amount of resistance your clients need 100% of the time. This means that the resistance can never become dangerous, is intuitive and simple to use, and can provide you with all of the results you and your clients are looking for in a fraction of the time. ARX is highly effective and efficient in delivering all of the benefits of exercise, including increased strength, muscle mass, cardiovascular conditioning, bone mineral density, and injury recovery. As well as being utilized by many high-intensity trainers to deliver highly effective and efficient workouts to their clients, ARX comes highly recommended by world-class trainers and brands, including Bulletproof, Tony Robbins, and Ben Greenfield Fitness. To find out more about ARX and get $500 off install when you place an order, please go to arxfit.com and mention Corporate Warrior in the How Did You Hear About Us field. So again, to get $500 off install when you order, head on over to arxfit.com and enter Corporate Warrior in the How Did You Hear About Us field. Hey guys, I am Lawrence Neal and welcome to another episode of Corporate Warrior, the podcast that shows you how to get the most out of your high intensity training and optimize your health and start and grow your own high intensity training business. My former guests include the who's who in high-intensity training, people like Dr. Doug McGuff, Drew Bay, and John Little, paleo pioneers like Mark Sisson, sports scientists like Dr. James Fisher and Dr. James Steele, successful strength training entrepreneurs, online business experts, exercise machine experts, high-intensity training bodybuilders, and everything in between. This podcast is also brought to you by the High Intensity Training Business Membership. This is where I've created a blueprint to help you grow your high intensity training business, including exclusive how-to content on things like sales and marketing and retention, monthly Q&As of experts, high-grade community full of thought leaders and high intensity training entrepreneurs, and private coaching from me to help you get maximum results. If you're interested in joining that community and that membership and growing your high intensity training business, then please go to corporatewarrior.co/membership. This podcast is featuring Dr. Ted Dreisinger. Ted has 32 years of clinical experience in rehabilitation, orthopedics, and physical medicine. Previously, Ted was Vice President of Outcomes Management for Integrated Pain Solutions, a network of U.S. pain management providers. He was Director of Research and Development for Dynamic Back and Neck Therapy Centers of Detroit, Michigan, as well as holding executive and research positions at spine centers in Columbia, Missouri. He has also consulted for corporate clients to advise them on how to reduce upper extremity cumulative trauma incidents and lower back injuries. Ted has published numerous articles in biomedical journals, including Spine, Orthopedics, Journal of Rheumatology, Sports Medicine, Paraplegia, and the Journal of Cardiac Rehabilitation. So yes, Dr. Ted Dreisinger knows a fair few things about how to prevent lower back pain. I actually recorded this a long time ago, back in June 2018. And, you've probably heard me say that on previous podcasts, and I do apologize. There's a fair few, which I did at this time, which will be coming out soon. But they will be shorter interviews in terms of when I interview the guest and when I actually get the episode out, so you won't have to wait so long. So just letting you know that habit will come to an end very soon. In this episode, we talk about Ted's relationship with Arthur Jones. We talk about the causes of back pain, why strengthening back with resistance is largely ignored for some strange reason. Studies that show how strength training lower back can help manage chronic lower back pain, and much, much more. So without further ado, I give you Dr. Ted Dreisinger. Dr. Ted Dreisinger, welcome back to Corporate Warrior.
Thank you, Lawrence. It's delightful to be with you.
Cool. Likewise. So yeah, we've got obviously I've sent you over a few talking points in relation to the issues with chronic lower back pain and some of the origins behind that, but also the importance of strength training to alleviate and improve those conditions. So we're definitely going to get into all that stuff, but I guess actually this may lead into us talking about Arthur Jones, as you mentioned just now. But let's kick off by talking about why back strengthening is currently ignored to a large extent.
Yeah, that's a really interesting question, because intuitively you would think, and certainly that's what I think, is that it should be a natural thing that we do. The strange thing about back pain in relationship to back strengthening, Lawrence, is that when people go to the doctor for back pain and then go into therapy, they're typically taught core exercises, which have a lot to do with what happens from the basically from your side to your front, meaning that a lot of work is done on the transverse abdominis and lateral muscle groups and that sort of thing. Maybe a little bit is done for something like, working on the rhomboids or some kind of rowing exercise. But people don't come to the doctor with discomfort in their rhomboids, and they don't come to the doctor with discomfort in their abdominal muscles. They come to the doctor with back pain. So it's always been odd to me why we don't address the area of the spine where people come with their symptoms, and that's their low back primarily, or their neck, occasionally thoracic spine, but the vast majority is low back, smaller amount cervical, and very small amount with thoracic back pain. So I think partly it's because the medical community has no training, no background in strength training. And this is a phenomenon that from a broader sort of an elevation of 50,000 feet, before the 1900s, that would be the 20th century, exercise was about the only way to treat any kind of disease. Galen in the 168 AD. Where being a student basically of Hippocrates, they didn't know any different. So he had these categories of exercise that you should do, and good air, good food, good exercise, et cetera, et cetera. So all doctors really knew to do when people appeared with chronic disease was to try to work on their diet and exercise them. Well, when bacteria were discovered at the turn of the century, we began to think that rest was better than exercise. And so up till about the 60s, nobody did much other than rest when they had chronic pain. Back pain was treated by, doing nothing. And so even in the early years in the 90s, when I got involved, early 90s, when I got involved in rehabilitation for the spine, all the emphasis was put on the front. And in fact, we used to do these exercises to flatten the back. And we would tell patients, think of your pelvis as a bowl of cherries. And when you're standing normally, it's tilted forward. So flatten your back in order to balance that bowl of cherries, and it'll help your back pain. Of course, all of that was wrong. Lumbar curve is important to have, and it's really valuable to not just, manage it passively, but to do exercise with it. One of the things that one of the big seminal influences was Robin McKenzie, when he began to do these mechanical low back exercises and do extension exercises that pump the disc. And so it would tend to move the disc nucleus forward or backward, depending on how the symptoms occurred. And that was a real turning point in some kind of quantitative approach to managing back pain. Still, that's a very small approach to back pain now, but even smaller strengthening. And yet, anybody that knows about the knee, for example, if you have a knee injury, what's the first thing you do? Once you stabilize the discomfort, you start exercising and strengthening the quads. Why do you do that? Because you want the medial and lateral collateral ligaments to stabilize that joint. In spine, when we've got back pain, what do we tell patients? All rest. Don't do much. Maybe do a little walking. Try to get back to normal activity. But we don't even think about strengthening the spine. And yet, the lumbar spine moves in exactly the same plane as the knee does. And in vivo, and that is to say in normal activity, like when we're alive and moving, The lumbar spine doesn't rotate if you're standing up straight. Yeah, you can bend and twist, but if you're standing up straight, the facet joints that stick out in the back of the spine keep you from rotating. So you're in the same movement that you are with the knee. And so the idea of not strengthening the spine from an intuitive standpoint and from the listeners of this podcast would seem very strange. Because if you want your bicep to strengthen, you strengthen your bicep. You want your quads, you strengthen your quads. Why wouldn't you strengthen your lumbar spine? So orthopedic surgeons, physical therapists, or physiotherapists for the part of your audience, don't have any background in strengthening or measurement really at all in their training. And so they just, it's like if you got a hammer, everything you see is a nail, and you do what you were trained to do. You find what you look for, you see what you know is sort of the idea. So strength people, in listening to this podcast, come to the table of back pain from a muscular strengthening standpoint. And so they have a clean slate. They're not thinking about all the teaching that they've had that focuses on everything but the back. So it's a big hump to overcome, and that's where Arthur Jones was so influential. He understood muscle strengthening, and he spent hundreds of thousands of dollars trying to measure knee strength. And as you probably know, the quads, when the knee is really flexed, is a flexor, and when you extend it, getting past a certain degree, it's an extensor. So measuring knee strength is really measuring knee strength is a problem. He finally gave up. But it was measuring the knee strength that led him to, well, what about the spine? And just like everything else that happens in life, you experiment with something and you're working on it, and something enters your peripheral vision, which is what happened with Arthur. This entered his peripheral vision. What about the spine? And he turned his attention to the back, and as a result, now in the narrative of back pain, we have the discussion about strengthening. But it's still a very small discussion. Still, physical therapists argue against it. They say, well, you're going to load the disc and you're going to increase the risk when you bend somebody over to put them into flexion. You're going to put the disc at risk. That's simply not true. Although disc pressure does go up, but there's no data to suggest that flexion is going to lead to an increased incidence of back pain, particularly if you load the back when you're in flexion. So if you load the spine, in other words, you put a weight against the spine that you're resisting as you go into extension, is translated to the facet joints. It's translated off the disc. So the disc pressure actually doesn't increase all that much when you go into extension from a flexed position when loaded. So it's really ignored from ignorance. I think we've medicalized back pain. Back pain is something almost everybody has at some time in their life, and we found a way to medicalize it. Just as an aside, back in the 1830s when trains just began to become active in London, or rather in England, there was this phenomenon called railway spine, where a train would begin to move, just a little bit of a bump when the car is engaged, and all kinds of people went to the doctor because of back pain from having this jolt that they got when the trains took off. So this is not a new phenomenon. We'll talk a little bit about that, I think, maybe when we talk about origins of back pain. So anyway, that's the deal. And thank God for Arthur, God for the people listening to this podcast who are not tainted by the teaching that says you shouldn't strengthen the spine because somehow it's more fragile.
That's really interesting, Ted, and a great way to start this podcast is giving some narrative on why, as you said, the back strengthening is largely ignored by the medical community, and it's a real shame. And you started talking about, obviously, Arthur Jones's influence and how he's influenced many of the listeners of this podcast and those in the strength training community. I'd love to hear more about your relationship with Arthur. You said, before we got recording, how you'd known him for a very long time. And obviously, I'm sure you've got some interesting tales. Could you elaborate on some of your fond memories?
Well, my initial exposure to Arthur was not a good one. Not him personally, but Jim Flanagan, who's known well by this audience, had a Nautilus meeting. There was a American business and fitness meeting in Toronto, Canada, in the 80s, and Arthur had sent Jim with a large display area of Nautilus equipment. And there was a large number of video screens. What a lot of people may not appreciate about Arthur was that he wasn't just a strength guy. He was really a Renaissance man, and he was an expert in video. He had a television program on in the 1950s that competed with wild animals, that competed with other programs in television. He was a great videographer, and he was the first guy that was able to stabilize video or filming from the air to not vibrate, so the cameras wouldn't vibrate when you were photographing animals from the air. There are many things about him that were amazing. But anyway, he had these about 10 or 15 camera screens with his then wife at the time riding on a horse, bareback on a horse in a fairly scanty outfit. And my initial reaction to that was, well, if the guy's trying to sell his equipment based on this, maybe it's not very good. So this was 1980, 1981, something like that. Jim and I met and we became friends, and it was the late 80s when I eventually met Arthur. And I'd gone to University of Florida, actually Shands Hospital, looking at some back testing equipment. I'd just gotten into spine, and Mike Pollock, who may be known to some of the people on this podcast, was an academic at the University of Florida. He and I were friends, and I went to see him, and he told me about Medix equipment, which I'd never heard of, and had been traveling around the country for months looking at back testing equipment. So I went to see Arthur, and at that time I was calling him Mr. Jones, and it's an odd thing. I was 38, and we met. He did a tour of the facility, and then I went home, and I was compelled to call the guy. So we left on a Friday. Saturday night, I had this urge to call him on the phone. I had nothing to say to him. I just had this urge, overwhelming urge. So finally, around 11 o'clock my time, which was midnight his time, I called him. And Arthur's probably the only guy that I can mimic in terms of making myself sound like him. So he answers the phone. Yeah, what do you want? And so I said, Mr. Jones, told him who I was, and the first thing he said was, how old are you? And I said, well, 38. And he said, why are you calling? I said, I have no idea. I'm just compelled to call. And that led to about 2 minutes of silence on the phone. Now, at that time, I was doing radio or had done radio. And 30 seconds of dead air is a nightmare. 2 minutes of dead air, and I was sweating, literally sweating. And then he just began to talk to me, and he said, maybe at your age you have an opportunity to learn something. And that's how I got to know him a little bit. From then, I was in Florida several times training for Medix and spent time with him. He took the time to teach me. There are a lot of stories, Lawrence, I could tell about Lawrence, and there are a lot of people that tell stories. And I've got a few, but I oftentimes feel uncomfortable because to me, he was the greatest teacher that I ever had. He was the smartest man I ever met. I've been in orthopedics a long time, and I've met the best people in the world in orthopedics. None of them were as brilliant as Arthur. They might have been smart, but Arthur had a level of peripheral vision. He could see things that other people couldn't see. He could smell somebody if they were bleeding. He could walk up to somebody if they had blood leaking. He was just, the funniest and the odd stories, because no doubt he was eccentric, are interesting. But to me, he was a great teacher, a mentor, and a guy who took the time to teach a PhD who was pretty ignorant about back strengthening and made it, easy to learn. Without him, in a lifetime, I couldn't have learned what he taught me. So I suppose your listeners aren't going to hear funny stories from me, at least about Arthur.
Oh, no, that's fine. It's interesting all the same. So could you elaborate? Obviously, you were a PhD, you'd learned a fair bit about, what was the PhD in specifically? Sorry.
So it's in exercise science with an emphasis on cardiovascular exercise. That's where I spent 15 years before I got into spine. I suppose I can say what Arthur said to me when we first met, because I got into spine because I was hired to ghostwrite for an orthopedic surgeon. That's all that's happened. So when Arthur, so keep in mind, I'm just meeting him for the first time. And he says, so what's your background? I said, well, I've got a PhD in exercise science. And he paused for a minute. He said, I used to think bodybuilders were the dumbest people that I ever met. And then he said, I met physical therapists who were the most ignorant human beings on the planet. After that, I thought there couldn't get worse. And then I met orthopedic surgeons who simply were beyond the pale. And then he got quiet and he looked at me and he said, and then I met PhD exercise physiologists. Jesus Christ, how stupid. So that was actually the initial physical meeting with Arthur. And I, of course, was taken a bit aback, but that was all overcome. So that I suppose is a funny story.
Very good. Yeah, he's a fascinating guy, and it would be amazing to meet him now. But yeah, it's very, very interesting indeed. Okay, great. So, we talked about, you gave a really great preface on why back strengthening is largely ignored. And, hopefully we can somewhat change that in our industry over time. Let's talk about the origins of back pain. I know you presented a little bit on this at the conference, but could you just give some background on where we are in terms of our understanding of the origins of back pain?
Yeah, and let me preface that, Lawrence, by saying that people should not be afraid to strengthen the back. Orthopedic surgeons, physical therapists tend to be afraid to strengthen the back because they don't want to be sued. They just don't have training. So why is the origin unclear? It's because there are so many variables that could affect back pain. Without getting into really the biochemistry, there are chemical issues. There are the disc itself is acidic. That's the nucleus of the disc. I used to tease that the disc looks like a jelly donut, but the center doesn't taste as good. But the actually, I've never tasted it. It's just a little humor. The nucleus is viscous. It's quite thick. It's made of a proteoglycan material that is quite acidic. So if you get a tear in the disc and some of it leaks out into the area around the nerve root, it can inflame it. That can be one reason. So that's an acidic reason. There are neurotrophins that are little growth factors that seem to be in greater number in people that have back pain. They sort of maybe overgrow and cause some pressure and therefore some pain. So that's chemical reasons. There are mechanical reasons. Maybe the disc pressure on the nerve roots. So you have a bulging disc that pushes out into the disc space, and it pushes against a nerve root, and it can cause maybe cause pain that goes down the leg into the buttock or thigh, or maybe below the knee. Weakness, I think, is a musculoskeletal weakness, a strain or a sprain of the low back from an accidental quick movement. For example, everybody knows in this audience the cross extensor patellar knee tap reflex. So you cross your knees and you tap the patellar tendon, and your foot kicks forward. Well, every muscle has little muscle spindles wrapped around them, and they like to move. They measure like, if you think of them as waist springs, they like to keep the tone of a muscle, kind of normal. So if you think of them as having a mind of their own, if you make a move too quickly, their reaction is to pull back. And so you tap the patellar tendon, it stretches the muscle very, very quickly. They don't like that. They shorten very quickly, and the knee extends. Well, when you pick up a box, for example, from the floor, let's say that box weighs 5 kilos, just for the example. The first 6 inches off the floor, when that box is accelerating, it might be as much as 20, 25 kilos, maybe 30 kilos from the acceleration forces. Well, you're bent over, you're picking it up quickly, and you can invoke possibly a stretch reflex that can cause an injury to the low back. That's one example, or picking something up quickly, twisting and turning and picking up quickly. So there can be this weakness, this mechanical thing. And then there's psychological issues that anybody that's worked clinically knows that all presentations that patients bring to the table are not legitimate. And there are many reasons. I mentioned this railway spine in the 1830s that a guy wrote a book called Whiplash and Other Useful Injuries. His name was Andrew Mallison, and he talks about how a lot of people use mechanical injuries, in this case whiplash, from called railway spine when the cars began to move and the acceleration from pulling car to car would jerk a little bit, and people would go to the doctor complaining that they'd been injured, and they would get some kind of compensatory treatment. So there are all these issues: chemical, mechanical, a weakness, and psychological. So the truth is that we don't know what causes back pain. Now, if you have an injury, sure, we know that. If you fall and your back hurts, we probably have an idea about that. But most back pain, the vast majority of back pain, is the origin is unknown. But the problem that comes from that is that each healthcare provider you go to gives you a different reason for your back pain. And if you go to several providers, what happens? You get several different diagnoses or several different reasons for your back pain. And in the end, what happens? You end up being confused and you're worse off than you were before you saw anybody. So it's a very complicated, unfortunately, because we've medicalized this whole thing, it's a very complicated issue. That's why the origin is unclear.
Do you still have some practitioners, some physiotherapists, let's say, who think differently to that and will quite often assume they know the cause of a subject's back pain when really, in reality, they don't?
Sure. All of us, comfort ourselves with our knowledge base. And the worst thing, if you're a professional or a PhD like me or whatever, is to have somebody question you, question your knowledge base, particularly when your knowledge base is faith-based as opposed to evidence-based. And so, unfortunately, in spine, because there are so many gurus that teach, it could be Maitland, it could be McKinsey, it could be Stanley Paris. I mean, the list goes on of people that are trained by different spine gurus, Kaltenborn, and that becomes a faith-based practice, not an evidence-based practice. The closest thing non-strengthening is the McKinsey group that has some evidence-based, an evidence-based model, but all the rest are just, it's like belonging to a church. You mix your faith with it, and you just hope nobody challenges your faith.
Yeah, it's so interesting. I find, and I've struggled with this a lot actually myself. Not back pain as such, well, a little bit maybe at times, but more this notion of admitting that I don't know or that I'm wrong. It's hard when I as part of my business I do help coach people mostly on beginners in high intensity training and people trying to optimize body composition, because obviously I've learned a fair bit, having done this podcast, interviewing, many experts and all the research outside of that. However, obviously all of us have gaps in our knowledge. No one knows everything. And it's definitely there. There have been times recently where I've struggled to say, I don't know. And yet I shouldn't feel like I can't say that. And it's a huge, I'm sure you'd agree, epidemic where people are uncomfortable and unable to say that. And maybe you can understand in a professional setting where it might affect their, their job, or their client retention. I don't know. But it's a real problem, that we're unable to just admit when we don't know or when it's unclear.
That's exactly right. And I think part of that is that somewhere in the back of our minds and hearts, we believe that there is an answer to everything. That somehow the reason we haven't drunk from the Holy Grail is because we just haven't quite found it yet, but we believe we're on the path. And the truth is, I think I say the truth. It's I suppose even that, but my sense is that there are many things that make people's lives better. And as you know, Lawrence, high intensity training is something that not everybody can do. But the people that do it see the results. And Lyndon Johnson, who used to be a president of the United States when I was a young guy, he said, science is good, but results are better. And the high intensity training community sees results. And because they see results, it's easy for them to accept the model because they know that it works. It's sort of like you drop a rock from your hand to the floor, and you can be pretty sure every time you let it go, it'll hit the floor because of the law of gravity. And yet, everybody listening to this podcast also knows that there are people who are not active exercisers who anything that they do will be better than doing the nothing that they're currently not doing, so to speak. And And so strength training may be the most important single thing that a person can do because of the nature of the integrity of the musculoskeletal system and its role in just about everything that we do from a movement standpoint. In fact, everything that we do from a movement standpoint: eating, drinking, swallowing, walking, sitting, lying, hugging, driving, fill in the blank. Everything that we do from a doing standpoint involves the musculoskeletal system. The non-exercises will point to guys like Winston Churchill, who lived into his 80s and smoked cigars and drank single malt whiskey, until his agonal gasp and so forth and so on. But he's the exception. He picked his parents well. But for the most part,
very grumpy though.
Very grumpy, and not always a nice man. But I think in the context of exercise, people see their lives change when they do high intensity exercise. They see it change. It happens quickly. It's not like a chronic disease that gets better. In a period of 2 months, you can see remarkable changes in somebody, sometimes even less. And because of the phenomenon, the advantage that people that strength train others and do it themselves in the early going is that there are all kinds of neuromuscular phenomenon that go on that lend themselves to encouraging people. I mean, it takes a while for the chemical changes in a muscle to actually begin to adapt to the strengthening, but the neural factors start adapting pretty quickly. And so somebody looks like they're getting stronger almost right away from one session to the next in the beginning. And that's a real motivator. And then the task is to help them appreciate that's going to flatten out, but their life is going to be better. And everybody knows they sleep better, they eat better. I mean, everything about their lives gets better when people strength train. So I'm not just, saying that people shouldn't do other things. I enjoy riding my bike and I like swimming and I enjoy morning walks with my wife. But what do I do for my health? I strength train.
That's cool. I didn't actually tell you this, Ted, but prior to us talking, I spoke to Martin Gabala, who's probably the foremost expert on high-intensity interval training over at McMaster University. And I also had Dr. Wayne Westcott on as well. So I've had a very busy day. And it's interesting because in both of those conversations, it came up that not everyone's preference is going to be high intensity strength training. There are people that don't want to do that, and doing something in a lot of cases is better than nothing. And I don't think that should make us in strength training business try to cater to all types of exercise, because that probably is not ideal either. Because I think if you try and offer too much in a service context, that people won't really probably take you that seriously, and you become too much of a generalist, and it's perhaps better to focus. And I'm sure Luke Carlson would attest to that. But it's just helpful, I think, to be aware that high intensity strength training, whilst probably the most beneficial type of exercise there is, in my opinion, it's not everyone's going to be up for that.
Well, that's right. And in fact, you're right. And it's not just an exercise. High intensity and good rest in between it works in everything. If you're a student preparing for an exam, so for example, right now I'm going to be teaching biology in the fall at a local college, and I'm preparing classes. I'm in hormones at the minute, but if you try to cram for an examination, meaning that you try to pull an all-nighter, you study for the thing, your chances of doing well are not so good. But if you study hard for a short period of time, you rest. You study hard for a short period of time, you rest. The information sinks down into your mind, and it's no different than high-intensity strength training. In anything that you do, whether it's cognition, a mental thing, preparing for an exam, studying for short bursts of time, letting that material sink in a little bit, and then come back at it again, it works the same way that high-intensity exercise training does. And HIT training is not just valuable in strength training, but if you do aerobic training, which is a relatively new literature, at least relatively new literature, high intensity aerobic training gives you a great benefit, as much of a benefit as long distance, high up on your aerobic capacity training. So everything that you do psychologically, physically, high intensity rest, you get the greatest benefit in everything that you do.
Yeah, it's. When I was talking to both Dr. Gabala and Dr. Westcott, Both were kind of the opinion that there may be benefit in supplementing strength training with high intensity interval training, or some kind of, well, in Dr. Wayne Westcott's case, some kind of power or speed training, which is it shouldn't be, but it's a highly controversial thing to say in the high intensity training community, from what I've heard so far. But it's definitely stuff to ponder, and those will be obviously available for people to listen to probably at the same time as this one is out. Okay, so far we've talked about why back strengthening is ignored. I think that's really interesting, and that definitely makes sense. And then you've talked about the origins, which it's clear how complex this really is, and how it almost sounds like it's real multifactorial in terms of the causes of back pain. Talk to us about the importance of strengthening the lower back to manage back pain, and I guess in some cases alleviate or eliminate back pain. Some of the research behind that.
Yeah, and let me just go back just a second to this comments a little bit earlier. You mentioned about if you're doing high intensity training, then probably that's what you ought to offer, and not get involved in every other area of fitness. And I completely agree with that. Just a small anecdote. Werner Kieser runs a bunch of Kieser training centers in Europe, which I'm sure you know.
I am.
And Werner's an old friend. And when I was in London a few years ago, I went to his club there, and there was a guy working out. And if you know the Kieser model, every facility looks exactly the same. I don't care where you are in the world. And the showers are all the same and so forth. So I'm in the locker room talking to a guy who just got done working out. And I asked him, about the workout and how it was. And it was basically an iteration of high intensity training. And he said, yeah, I come here to lift weights, but I go to the gym to exercise. And that was, it gave me a little bit of cognitive dissonance, because in his mind, and in minds of some of the other people that were coming to the Kieser facility, they came to the Kieser facility to strength train, and they could do it in their street clothes, and they didn't have to take a shower or whatever. But they went to the gym to exercise. And so in their minds, there was difference between the high intensity training they were doing there and going to the gym and working on a treadmill or stair climbing or whatever else they were doing there. So,
yeah, I bet that's still so prevalent as well, that mindset of separating the two. And I know the exact facility. It's in Mornington Crescent, North London, because I used to train there. I trained there for a couple of years. Loved it and miss it so much. You'll actually be quite upset to hear this probably, but I did start using their Med-X lower back, but I got so obsessed with chasing muscle hypertrophy optimization that I just ignored anything that was not about that. So I actually started doing a lot of big 2, big 3 type workouts. Whereas if I was using the Kieser facility now, utilizing their lower back, because obviously there's such a hard to find and expensive piece of equipment, would be my primary goal. But sorry, I interrupted.
No. I completely understand. Now you're going to have to ask me the question again, because I got sidetracked.
Yeah, that's right. We were just going to go into some of the studies showing the importance of strength training the lower back to manage chronic lower back pain.
Yeah, and there are a lot of papers in this arena, which is a good news. And so in the early work that Mike Pollack did at the University of Florida, in concert with Arthur, although separate from Arthur, and that was purposeful. The randomized controlled trials looking at just strengthening, frequency, intensity, the period strengthening and so forth, rest periods and all of that were really well done. So the foundation for the clinical work is probably better than any other model in strengthening that maybe has ever been done. I mean, there are 20 papers on just on the science of strengthening, unrelated to back pain. And then you get into the work by James Fisher and James Steele and that group in England, Before that, there were a few papers. Some I was involved in, others I wasn't involved in, but I was part of the group that were involved. Back in the 90s, there was a coal company and a strip mining company in Montana that I did some work with a little bit later after this paper was presented. So they had back injuries that were about 2.5 injuries per 200,000 employees. 2.5 injuries per 200,000 employees. Now, put that in context, the industry numbers at that time was 1.09. So they were almost 2 times the industry injury rate in strip mining in Montana. So they were put into this medic strengthening program, which was isolated lumbar strengthening and exercise to volitional fatigue. I won't say necessarily failure, but volitional fatigue. And their incidence rate dropped to 0.52 per 200,000. So they went from 2.5 almost a 5-fold reduction in injury rates. That translated into cost savings of from $14,000 plus dollars per month in U.S. dollars to $380 per month for a 2-year period after they were strength trained in this cohort of workers. So this was the first paper that we were involved in and looked at that was that reduced costs for strength training. Then Brian Nelson, who should be known to some of your listeners, at least that are interested in back pain, took 895 consecutive back pain patients back in the mid 90s, and put them into an exercise versus control group, workers' compensation versus non-working compensation. So for non-Americans that are listening to this, our compensation environment here has to do with people that are under government care, and workers' compensation pays for their care, and oftentimes they don't do as well for obvious compensatory reasons, which have to do a little bit with the psychological issues we talked about earlier. So in the non-workers comp group, the exercise group reused the healthcare system at the end of a year at about 13%. The control in the non-workers comp about 42%. So there was almost a 4-fold decrease in the exercising group in regular people that just came. In the workers' compensation group, 76% of patients came back at the end of a year that did not exercise, but the people that did exercise, 25% came back, and that's a huge decrease. That's a very favorable number in both the regular exercising community and the workers' comp community. These are back pain patients. And then we were involved in a 2-year, 2-center study with a year follow-up in the late 90s. And we looked at, in Minnesota and in California, patients that were put into a medics program. And then we looked at reutilization of the healthcare system. So we looked at strength and quality of life changes and pain changes and all that sort of thing. But the real key was, what were the costs at the end of a year? And in the patients that exercised in the chronic back pain patients, it was about a 10% reuse of the healthcare system, 10%. Now, to put that in context, the average reuse of the healthcare system at a year is about 42% in the general population in spine. Here in Europe, pretty much anywhere you look at the data. So this was about a quarter of reuse of the system. That translates into dollars. And a hard dollar translation was a group of patients, a cohort of this larger 895 group that we looked at. There were 33 patients that had been given a diagnosis that required surgery now. So it was recommended to these 33 patients that they needed surgery now. And these patients self-selected having surgery, 30 did not. Now, this wasn't a controlled study, and there are a lot of arguments that could be made about it. But the cost savings was about $3.6 million. So can strength training of the low back reduce costs in chronic back pain? Absolutely. And the data are pretty strong about it. The funny thing, the strange thing about it is I've been involved with Paul Hodges and his group out of Australia and some researchers in Europe, and they never look at these data when they're talking about back pain. They always look at epidemiologic data and other core activity data, motor control data, but they never look at these strengthening data. And yet, going back to Lyndon Johnson, science is good, but results are better. And companies that see a reduction in their costs, that's what's important to them.
This episode is brought to you by our sponsor, ARX. Are you looking to create a cutting-edge, high-intensity training facility? Are you confused on what equipment to use or how to separate yourself from the masses? Well, then ARX Fit might be the answer you're looking for. I asked Mike Polano from ARX a few questions about how ARX machines are challenging the status quo of the exercise industry around the globe. Mike, if you could, give the listeners a quick summary of why ARX is so different from the traditional machines or tools they're used to seeing in most exercise facilities.
ARX is totally different than anything you've seen before. This isn't just another weight stack machine. We've looked at the last 40 years of exercise technology and used that knowledge to create something entirely new. ARX uses a new form of resistance, a motor, and we pair that motor with computer software so that we can maximize the safety, effectiveness, and efficiency of your workouts. So you may be asking, okay, but how does ARX compare to weights? Traditional machines you see in gyms today are based on lifting metal weights and battling gravity. What people don't realize is that when you're forced to lift a static weight like this, one that doesn't adapt or change while you use it, you're underloading yourself rep after rep. And this unnecessarily limits your ability to make improvements. With ARX, we've taken a totally different approach. We removed weights and gravity from the equation altogether. Instead, ARX combines our patented motorized resistance with our custom computer software to provide you with the world's safest, most effective, and most quantified form of resistance training ever. When you train with ARX, you are training to your perfect level of resistance, both positively and negatively 100% of the time. No more guessing what weight to use. ARX does all of that for you, instantly and automatically. We'll also track and measure every second of every rep, so you can quantify all of your workouts to find out if you're improving and by exactly how much. Whether your goals are bigger muscles, increased strength, stronger bones, or just to look good in a bathing suit, ARX can help you achieve all of these and more, but do so in a fraction of the time it would take compared to traditional equipment. If you're looking for the most efficient, most effective, and most quantified piece of exercise equipment on the market today, then look no further than ARX.
Thanks, Mike. That all sounds really impressive. If you'd like to learn more about ARX, visit arxfit.com and mention that you heard about ARX on the Corporate Warrior podcast to receive an exclusive deal of $500 off shipping and installation off your ARX machines. Makes you want to just go back a second and talk about this issue that you raised regarding, why is it that, because I was having a conversation with someone recently about, we create, we often discover stuff prior to the science proving it, right? We find out about it in the real world or in the gym or whatever. Or at least we think we do and we just kind of experiment. And then, whatever it is, a few years down the line or sometimes a lot longer than that, and the science comes out to kind of prove it. Now, and the reason we often do the science is so that we have the ability to then use that as leverage to change things like public health and recommendations that come from the administration, to kind of put it as a catch-all term. And yet in back strengthening, that doesn't sound like that's the case. You said, there's all this literature to support the importance of strengthening the lower back and how that can alleviate back pain. And obviously you've talked about the commercial implications there as well. So why is it that's still the case? Why is it that we can't just, why are we still stuck in the dark ages in terms of the medical community, it would seem in some cases?
Well, it reminds me of Don Quixote in Man from La Mancha, who says facts are the enemies of truth. And so we are in a fact-challenged era in this country at the moment politically, and to the extent that we now talk about alternate facts, and it's sort of like saying, we have an alternate description of gravity where we don't have to be concerned about jumping off a bridge, that kind of mentality. I think it's partly because of the great amount of inertia that people have put into the healthcare system, Lawrence, and the amount of money. That's something we haven't talked about. But money, the amount of people that are sort of eating at the trough, financial trough, is astonishing. For example, let's say you have a multidisciplinary spine program at a university. And in that program, you've got a psychologist, physiotherapist. You probably have maybe a pain doctor, a psychologist. Those people need to get paid. And so somebody enters the system, sort of like, queuing up to get into the movies or something, or the wonderful theater in London, it's the West End. At any rate, you get into the line. And when you get into the theater, all these people have a piece that they need to take from the economic model that's supporting it. So whether you need a psych guy or not doesn't matter. Whether you need a physio or not, it doesn't matter. Whether you need a pain guy, it doesn't matter. Everybody sees you, and the amount of revenue into the system is just overwhelming. And the reason that I think, in personal opinion, that people are able to get away with it is because the evidence is so soft around the management of spine. And so you can do just about anything you want. I mean, if you look in some of the sort of methods of treating back pain, I mean, it goes everywhere from rolfing and massage to strengthening and 10 or 15 other sorts of approaches in between. Each healthcare provider, so-called healthcare provider, has a different approach. And so there's just so much inertia involved in the system. And yet everybody that's listening to this knows this, that when you're weak and you exercise, you get stronger. And the best analogy I can give is when I was a kid, my mom used to measure my height in the kitchen. And I would see that change and I would feel pretty good about it. And in truth, I was a little disappointed when I stopped growing, even though I was probably taller than I should have been, particularly now as I'm older and balanced and all that kind of stuff for issues, airplane seats and stuff. But the point is there was a metric, a measurement. And when you see a measurement, things change. And one of the great things that happens in a spine clinic, chronic back pain clinic, and that's the reason strengthening is so meaningful to me, patients do the work and they see the change. And that mediates the psychological, negative psychological problems. It certainly addresses weakness. The mechanical issues are overcome. And in my estimation, the chemistry is better because you're flushing out the area of the injury. So does it make everything better? No. But does it make most things better? Yes. And the best thing is patients come home and say, yeah, I'm better. You have a knee patient that comes home from therapy and his wife says to him or her husband says to her, how is therapy today? And the patient says, well, it hurt like hell, but I got 2 more degrees of motion in my knee. And the 2 more degrees of motion was enough to get that patient to go back and go through the pain again of more exercise. Well, when you show a patient that they are better and that they can do more work, guess what happens? They want to come back. And the good news is when you strengthen a muscle, you increase the tissue, you increase blood flow, you increase the metabolic things that happen in that tissue. So, I mean, there are just so many. I could probably go on longer than anybody needs to hear, but the benefit of measurement cannot be underestimated. It cannot be underestimated.
Yeah, that's so interesting. And that applies across all of, obviously not just strengthening of the lower back, but in terms of personal training people, or in fact, in any domain, if you can show improvement in results in anything, it's so motivational. Yeah, that's a huge thing to use. Just curious, Ted, how is, you've said before you're 70, is that right?
Yeah, 70, yeah. Hard to believe.
and I'm curious, we spoke about at the conference, you told me how you could, when you were in your mid-60s, you could use 350 pounds on the lower back machine, the Medix lower back, I believe. Yep. I'd be really curious to know, how is your back health now? And what do you do now to continue to exercise that?
My back health is, thank God, I knock on wood, I'm tapping my head as I'm saying that. My back, I really have only had 2 episodes of back pain in my entire life, and both of them were associated. I don't know whether they were caused. Causation's a pretty strong word. They were associated with lifting something inappropriately or bending after having exposed my back to long sitting vibration for a period of time. Otherwise, I haven't had any trouble. What I do now is I use a Roman chair once a week, and the key to the Roman chair is to not use your glutes and not use your hamstrings. Almost everybody does that exercise wrong. It's where you lie on your tummy and you've got the pad at your hips. And I like the angulated Roman chair, the 45-degree chair, better because you load the spine when you're in full flexion. In a horizontal chair, when you're in full flexion, you have no resistance because you're hanging straight down. But anyway, that's a different issue. But I do low back exercises on that thing once a week to failure. And for me, failure is about 15 reps. And I really can't do more than that if I don't use my glutes or my hamstrings. So if you pigeon toe yourself and you scoop your head up and concentrate on relaxing your glutes as you come up and don't go much past horizontal. And when you get into that position, squeeze like you're squeezing a trigger, on a gun. You'll be surprised how quickly you'll fatigue doing that exercise.
What do you mean pigeon toe yourself? What do you mean by that?
Well, if you turn your toes in when you're on the platform for your feet, it tends to reduce the ability of the glutes to fully contract.
Got it.
So it's just kind of a way to turn them off a little bit.
Yeah, and that's great advice. And for anyone who's interested in learning about all of the exercises you can do for the lower back, and me and Ted pretty much rank all of them in our previous episode. So I'll point to the exact minute in the blog post of this, which will be over at corporatewarrior.co/Ted. And we'll repeat that at the end of this as well. Fascinating. Cool. Okay. So that's really interesting to know because I find for myself, I'm 31 and occasionally I have very mild back pain, but I reckon that's down to typically a bit too much sitting lately, if I'm honest. And I'm sitting in, so sometimes I'll sit in my kitchen to work because I've got like an open plan thing going on. And my table's quite low, so I'm actually curved my upper back, and I don't know whether, I think that's kyphosis, potentially. Yep. Yeah. And so I don't have so much lower back pain at all, actually, because I do look after that with things like prone trunk extensions. And obviously I do other multi-joint movements where I believe I'm fatiguing that enough to keep that pretty strong.
Sure.
And pull-ups and other things that may help that along. However, I do definitely feel some very mild pain in my upper back after too much prolonged, curving the back to look down. So I guess is the best way to stop that from happening to sit? Is that why they recommend you, if you're at a laptop, your screen should be in line with your eye line, so as you're not curving downward?
Well, I have two very quick comments about it. One is the field of ergonomics, meaning just what you talked about, hasn't saved one dime in costs for back pain or neck pain. So I'm not saying ergonomics aren't good. They are good, and a lumbar roll can be very helpful in posture. But I'm just saying that if you've ever lay down on your couch watching television and fallen asleep with a pillow under your neck, and then gotten up and had extreme pain in your neck, you'll understand the phenomenon you've just described, Lawrence. Or if you take your finger, your pointer finger, and you bend it back about as far as you can and then hold it for about 30 seconds, it'll start to get pretty uncomfortable. And if you hold it for a minute, it'll be really uncomfortable. But when you release that tension and wiggle your finger, the pain goes right away. So connective tissue, when it's loaded over time, and that's what happens when you sit hunched over, you've got connective tissue in the upper back that's hanging. You're sort of hanging on your connective tissue. Blood flow gets decreased, movement is decreased, and discomfort comes. So I think it's probably right to sort of have the screen a little bit better. But my technique is to keep a glass of water with me when I'm working, because every 45 minutes I have to go to the bathroom. And when I have to go to the bathroom, I have to get up. And when I get up, I have to move. So when I'm in something,
life hack.
Yeah, because when I'm preparing like for courses right now, I could sit behind my computer for 8 hours and forget about getting up. And I've done that many times as a younger guy. And then you get up and you can barely move. So my bladder is much more responsive than my cognitive capabilities. So that's what I do.
I love that because, so many people advocate, set a timer every 40 minutes or whatever. And I'm like, no one's going to do that. A lot of these strategies I just don't think people comply with. Whereas when it comes to, going to the toilet, I don't think you ignore that.
Well, that's right. That's right. And if when you sit down, drink that cup of water straight away. Fill it up when you go to the bathroom, sit down, drink that thing straight away. Trust me, you will not sit too long.
Yeah, that's good. And I suppose, I guess where we're alluding to is, sitting in any position is bad if you hold it long enough. There's no optimal way to sit, because you're always stretching the lower back, aren't you? Shortening a hip flexor, aren't you, if you're in a seated position? And that's a stretch in itself, right? It goes back to what you were saying. Am I accurate in saying that?
Yes, but there's another side of that. There's
Sure.
really no evidence in the sitting literature, and there have been one or two or three, trials and reviews and stuff. The latest that I looked at was in 2012 because I'm always interested in that kind of stuff. There really hasn't been any data that shows that sitting has much of a negative influence on back pain. Having said that, there is some evidence that sitting for long periods of time has an effect on diabetes and cardiovascular risk, and that has a lot to do with pooling of blood in the lower extremities. That's my opinion, from my background. My opinion is you pool blood, it becomes a little bit static, not fully static, of course. The venous system doesn't get the blowback that it needs to get to the inferior vena cava, et cetera, et cetera, et cetera. So I think a lot of that has to do, particularly the health factors of diabetes and circulatory stuff. People read that sort of thing. By the time it gets to the lay literature, like a newspaper article or something, and it says, sitting will affect your overall health. Well, probably yes, but the real issue is if you got diabetes or if you have cardiovascular risks, that's where it's a problem.
Interesting. Okay. I guess I wonder how that might change if you're eating very well and strength training to failure. I mean, would that mean that this is less of a concern, or do you think it's still a concern regardless?
Well, I think that if you're sitting and going to the bathroom at regular intervals, you're probably helped with that. And then, of course, I can't emphasize how important strength training is. And if you can only do one thing for your health, and I talked about this in Minneapolis, strength training gives you increase in balance, flexibility, cardiovascular. VO2 goes up when you strength train, and strength. So you get benefits for everything when you strength train. There's just no downside to it.
Yeah, big bang for your buck.
Absolutely.
In terms of one thing we didn't really talk about much, actually, last time we spoke was the protocol for strengthening the lower back. What's your view on optimal or ideal frequency of training?
Yeah, that's a really good question, Lawrence, because if you look at most of the lifting in the medics environment that I've been involved in is done by the multifidi. It's a short stroke muscle. It's got a huge leverage. It that connects the facets together, and it's pretty hard to injure that thing. The longer muscles, the erector spinae and stuff, aren't that involved in. They are involved, but they don't have the big lifting torque that's provided by the multifidi. But if you look at multifidi under a microscope in normal people that don't have back pain, the muscle looks a little bit moth-eaten. It looks like it's pathologic. I'm talking now about the type 2 fibers, the fast twitch fibers, and it almost looks like it's sick. So the multifidi are very untrained, and they take time to recover because they just haven't had much activity. When you stand up and you bend over, you generally hang on your lumbosacral fascia. You don't do much loading with the lumbar extensors when you're just bending over, pick something up. A lot of it's taken up in the glutes and the hamstrings. So the low back kind of goes along for the ride. So frequency, no more than once a week. The data that came out of Florida in the early days, once a week, twice a week, 3 times a week, once a week was pretty good. And in the chronic patient, the work that's been done by Fisher and Steele and their group show that once a week gives the same benefit 3 times a week. So you don't want to overdo those little muscles. And it takes time for them to, get back to normal metabolism. I don't know what that time is because I've never looked at muscle punches before and after training, but I've certainly looked at muscle punches before training. Mm-hmm. So no more than once a week, and one set to volitional fatigue, or in the parlance of this organization, failure.
Just another question on that then. Does it matter, like for instance, if you're using a Med-X lower back, it's probably the most effective way to stimulate the lower back muscles. Whereas a Roman chair or a prone trunk extension is slightly less direct. So with that in mind, does that mean that the former the dose may be different based on that? Or like, for instance, if you're doing Roman chair, should you do that twice a week versus once a week on the Med-X, or does that not matter really?
Well, in certain regards, it's individual for this reason. And then everybody in this audience knows this. Sure. If you overtrain, you begin to lose strength, right? Yeah. So if you do twice a week, for example, and you begin to lose strength in the case of the Roman chair, you can do less repetitions. Then you're overtraining, and so you should back off and move it to once a week or every 5 days or something like that until you titrate in for yourself. And that's the problem with evidence. We look at everybody as if they're exactly the same, and you and I are both men, but we don't look the same. We both eat the same kind of food, but we don't look the same. So everybody's an individual. We have to kind of sort things out. There are global things we know about strength training, and we should follow those. But then we need to be sensitive to those people who fall outside the normal standard deviation.
Yeah, got it. I'm sure I appreciate what you're saying. It's like understanding your individual response and adjusting your training frequency and volume accordingly, which obviously the listeners know all too well, especially listening to this podcast.
Yeah, people listening to this are much more expert than I am. That's for sure.
This is going to sound like a very dumb question, but it's I don't care. I'm going to ask it anyway. So we're told or educated by, I guess, society to never bend over and lift stuff up. You should always use your legs to lift. I just wondered if you've got a very strong back, and you're not suffering from this massive amount of deconditioning that we see. Are you still at risk? Should we still be lifting with our legs? Does it still make a lot more sense to do that versus bending at the back when you lift something heavy?
Well, Bert Mooney and I used to talk about this a lot. This has to do with lever arms. And for just a moment, to answer this question, you need to think about a lever arm. Lever arm meaning that if you're holding a broom by your fingers, is it easier for you to hold it in the middle of the broomstick or at the very end? And the answer is it's easier to hold it in the middle. Why? Because the lever arm is shorter when you're holding that broom in the middle. If you hold it at the end, you've got the entire length of the broom that you're trying to hold with your fingers. It's more difficult. Got that picture?
Yep.
All right. When you pick something up, you want to minimize the lever arm of whatever you're picking up to where that lever arm is initiated, and generally it's somewhere around the low back. So you want to bring that thing as close to the body as you possibly can to lift it. And so I would answer the question somewhat this way. It's much easier to lift with straight legs and your low back many items that you can keep closer to your legs as you lift them. Because when you do that, and this is heresy to a lot of people who are listening to this, certainly it's heresy to physical therapists that work in this kind of arena. But if you put someone through a back training program in an industrial setting in a company or something like that, and teach them to lift with their knees bent every single time, no matter what that weight is, you come back in a month and they're doing what they always did. They bend over and lift with their back. People are not just naturally are not inclined to lift with their knees bent. So the key is to if it's too big to get between your legs with your legs bent, get it really close into you and lift it up next to your body to minimize that lever arm. Then someone probably ought to help you lift the thing. But lifting it with your low back and picking it up, there's absolutely nothing wrong with it. And by the way, when you do that, you invoke the use of your lumbar extensors. You don't use them as a static rod that you would do if you were lifting with your legs. So there's the heresy. Heresy 101.
I guess the exception is if you're really deconditioned, though, right? And you're weak, then you might be at risk unless you strengthen them more safely. Is that a fair point?
It's hard. I really can't answer that, Lawrence, because I don't know of any data, first of all, that knows when people have a weak back and then get injured.
Right.
We know that strengthening your back doesn't change the general injury rates. It does have an effect on re-injury. But there's just a lot of stuff we just don't know. So I really don't know the answer to that. I can suppose what I think, but I really don't know the answer.
What do you think?
Well, I think that if you're careful lifting, that the multifidi will do their job. And the only reason I say that is because when I was a naive lifter in the medics in the beginning, I started off lifting a couple 100 pounds, and I'd never lifted anything with my back before. And I eventually got to 350. So there I had a weak back. I was tall, had a long lever arm, from my trunk to my shoulders. I'm kind of a tall guy. And I never had any difficulty at all. But that was in a constrained environment. That's kind of why I like machines. If you're in a free axial environment, where you can move around, slip, do something wrong, it's probably safer to, I don't know, maybe lift with your legs. I really don't know.
Yeah, no, that's fine. And I should also mention, I know you've mentioned them before a couple of times, James Fisher and James Steele, who are good friends of mine and have obviously been on this podcast tons of times. And I know I have actually done some content with James Steele on chronic lower back pain. I know he's done a lot of work on that. His PhD was in that. So, I'll be sure to link to those for further references on this for people. Something that come to mind just now, which I wanted to get your opinion on, is this exercise called the Jefferson curl. Have you heard of that?
Tell me what it is.
So this is something I heard from in gymnastic strength training. And at first, I looked at it thinking that's a terrible idea, but now I'm starting to think maybe it's not the worst idea in the world. And basically, it's where actually, it probably is a bad idea for other reasons. But if you're imagine you're standing on a box with a barbell, maybe a lightly loaded barbell, nothing too crazy. And what you do is you start with your hands holding the bar by your knees, and then rather than lowering with your by bending your legs, you're just curling your back very, very gradually and sliding the bar down towards your feet. And obviously the reason you're on a box is so that you have greater range of motion. You can pass the barbell even further down, but you're just curling, and you're like almost curling the vertebrae of your back ever so gradually as you go down. Does that make sense?
Sure.
And when I first heard that, I thought, what a terrible idea. Firstly, the moment arm with the barbell out like that, you're just going to fall forward and like injure yourself. And I definitely think that is a potential issue with that. Especially with people who haven't perhaps got that skill set down where they can balance in a box like that. But now I'm thinking, actually, with what you just said, maybe there isn't so much risk to the back, because I thought there's perhaps a lot of risk with the back in that context.
Yeah, so I don't know about the box part because you'd go sort of below your feet. But certainly going to the ground and coming up like that, and maybe if you practice, you get the Jefferson curl working right. Here's part of the thought process on this and why I feel like it's not too terribly much of a problem. First of all, I don't know the incidence rate of injury, so there might be injuries that I don't know anything about. So I'm pretty naive about that, and I don't know. But when you begin the exercise with an eccentric load, right, a negative load. And as everybody listening to this podcast knows, that the contractile fibers, when they're going into an eccentric contraction, the actin and myosin are breaking apart, and so you have the viscosity of the contractile unit in addition to the resistance of the paddles, basically on the myosin fibrils, breaking off the actin fiber, and so that's all assisting you, right? So you're lowering a weight in a pretty safe environment because the viscosity of the muscle and the breaking apart of the fibrils assist you in the amount of force, the amount of mass that you're lowering. Then when you come back up, of course, it's a concentric load, and you're having the opposite effect. You're having to overcome the viscosity of the muscle as the fiber shortens, and you're having to, link up the little paddles on the myosin and pull yourself into a full position. So a preload, depending on how much the muscle is stretched, and I think I mentioned this in Minneapolis at the conference, it's pretty hard to overstretch the multifidi just because of the mechanics of their connection to the facets. So they only really operate in a mechanically advantageous region. And on the strength length tension curve, they really don't get overstretched just because of the mechanics. So, I probably would be interested in the data. I don't know if anything's been collected on it. I don't know what the injury rates might be.
I doubt that.
Yeah. So unless people are saying, man, I got hurt. And here's the thing. These are primarily for exercise, for athletes, right? Do athletes do this?
Yeah, but it's becoming gymnastic strength training, although it sounds very athletic, it's almost becoming more of a popular way to exercise. It's kind of like CrossFit emerged. I mean, I know a lot of us have reservations of CrossFit, but gymnastics and I can see why. But gymnastic strength training, I don't know enough about it to comment, but at first glance, I do feel that it may fall into a similar bucket as CrossFit, unfortunately. But that's me kind of making an assumption before I know too much, which probably isn't a great idea. But yeah, so I don't know if that answers your question.
But the key here, I think, in everything is slow movement. So that if you are moving slowly, you're not invoking a stretch reflex, and you're not invoking that sort of single arc reflex that will cause the muscles to try to contract when they're being loaded into extension, which is where most injury occurs, and almost all that happens at the myotendinous junction. So I wish I knew more about it. I have an idea now what you're talking about, but I don't know much about it.
Yeah, well, if you're interested, just Google Jefferson curl.
Yeah, I'll do that.
I've done it before with an unloaded barbell, and it felt nice. If anything else, it actually kind of felt kind of nice to just use the body and move the body in that way. I think there may be something to it. I'll leave it there because I don't want to comment anymore on it.
I understand.
But yeah, I'm open-minded, as I know you are. So I guess one more thing, Ted, before we wrap up. We've really covered, encompassed a lot of the aspects of causes of lower back pain. Why it's the strengthening of lower back's ignored. You've talked a lot about how to strengthen it, some of the studies and data around that. Do you have anything else to say? Any sort of parting words to the listeners on this theme of lower back pain? Is there anything else you want to impart the listeners with before we wrap up?
Well, it's a little bit of a fair weather warning, meaning that in my opinion, if you are careful with the low back and you load it and you exercise it, it's pretty safe. And as everybody knows, it's the first rep that's the most dangerous, and then the second rep is a little less, the third is less, because you just can't generate the torque, and so the more reps you do, the safer it becomes. The thing to be careful about is the healthcare system. Physiotherapists will go crazy, as will physicians, if they think that you're treating people that have back pain. So I think probably the most careful thing I can say about this is don't try to overextend your training. In other words, whatever your scope of, I say practice, but your scope of training is, don't overstep that. And that has a little bit to do with a conversation that you and I had, Lawrence, about being able to say, I don't know. When we don't know something, it's really refreshing to be able to say, I don't know. And back pain can become complicated very quickly, not always because of the clinical entity that's presenting itself, but all of the things that come with it. It's a hairy monster. And part of the hair on that monster are doctors and therapists and occupational therapists and other healthcare providers that feel like back pain is their area. Chiropractors, fill in the blank, osteopaths, fill in the blank. So you need to be very careful. If you're treating somebody who has been seen by a physician or a physio, you got to ask them if it's okay. And sometimes they'll be condescending and tell you it isn't okay when you know in your heart that it is. But I would just give the caution that stay within your scope of practice. You'll get a lot of people better.
Yeah, this is interesting because I recently interviewed Bryce Lee, who's one of my listeners, but has recently opened a strength training business himself, and he's got a very, very strong physical therapist background. But he's now been, I'm not sure how long actually now, but he's very much into high intensity strength training. So he's very, very aware of the two different worlds. Which is very cool because he can see everything that's wrong with his own, his sort of previous discipline, as I'm sure you know, and as you've described a bit on this podcast. But so he's in a really great position where he can kind of demonstrate knowledge from both fields. And then obviously use that. And we talked a lot. And the reason I bring that up is that will definitely be out by the point that this is out. So listeners can use that as a way to figure out how they can partner with the right type of physical therapists and the right type of people to help clear clients for training. Because obviously that's key in terms of being able to help people as much as we can and get the best results.
And being humble is really valuable. So I'm a PhD, and my world has been primarily in orthopedic surgeons, and I'm certain no orthopedic surgeon is going to be listening to this, so I'll just say this, that the only people, well, that's true, but I'll say this anyway. The only people I know that are more insecure than bodybuilders are orthopedic surgeons. And what I mean by that is that they're very well trained in their field. They know their field really well. But there are a lot of secondary psychological overlays about knowing your field pretty well. And when anybody challenges you, it becomes a real issue. So I've learned that I don't have the secret handshake of a physician or orthopedic surgeon. So I'm hat in hand all the time. I know when an ortho person meets me or physio meets me, they don't know what I know, but they only know that a guy who's trained like I have has spent a lot of time learning something. And they're always suspicious that I know something more than them. And so whether I do or I don't, I try to keep that diffused all the time by never trying to ever put them down, never ever trying to discredit what they know or don't know. It's sort of like you don't ever wear a better tie in the office than your boss is wearing. and that's sort of the mentality that allows for great success in your field.
Yeah, and this is going to make you laugh, but there is probably one orthopedic surgeon that I know who does listen to this show, but they're the type of orthopedic surgeon who would laugh out loud at that comment because they probably wholeheartedly agree with you. Because they are also somewhat jaded with that industry, and so they'll probably agree with you massively on that comment.
Yeah, I've managed those guys for about 35 years. So
okay. Ted, this has been such a pleasure. Thank you so much for taking the time to come on the show today, and it's been a lot of fun, and I've learned a lot. These are some of the questions I've asked you, things I've been pondering for a while, and I think this is a great piece of content that people can refer back to if they want to learn more about lower back pain and how to prevent it, especially in tandem with the previous episode we recorded together. So one more thing before I wrap up. And what's the best way for the listeners to find out more about you, Ted?
Well, they can Google me. I'm happy for them to email me anytime. My email address is Dreisinger at therapyadvisors.com. therapyadvisors.com. So that's my work address, and I'm happy for anybody to contact me for any reason. And I don't want to get off this podcast without saying how pleased I am to be able to do this with you, Lawrence, and that when I was able to do the conference in Minneapolis earlier this year, what a stunning revelation to me to be around such an enthusiastic, forward-thinking, great group of passionate people that are involved in high-intensity training, strength training. So I was honored to be there. I'm honored to be here. So thank you.
Thank you so much. And for everyone listening, to find the blog post for this episode, please go to Corporate Warrior. Did I say corporatewarrior.co/TED before? I think I did, didn't I? Actually, I don't think that's available. So I'm going to change that. I'm probably going to edit that. So yeah, to find the blog post, go to corporatewarrior.co/lower back pain. We'll just use that one. And to find a full list of episodes, please go to corporatewarrior.co/podcast. And until next time, guys, thank you very much for listening. I hope you enjoyed that. Before you head off, head on over to corporatewarrior.co/ebook to get your free high-intensity training Google Sheet to track your training progress. And get my ebook with 20 interview transcripts with some of my top guests, including Dr. Doug McGuff, Drew Bay, and Bill Day Simone, on how to optimize muscle gain, fat loss, and overall health in an efficient, effective, and sustainable way. Head on over to corporatewarrior.co/ebook now and enter your email address for instant access. This episode is brought to you by ARX, the most innovative, efficient, and effective all-in-one exercise machines I have ever seen. I was really impressed with my ARX workout. The intensity and adaptive resistance was unlike anything I've ever experienced. I love how the machine enables you to increase the negative load to fatigue target muscles more quickly, and I love how the workouts are effortlessly quantified. The software tracks maximum force output, rate of work, total amount of work done, and more in front of you on screen, allowing you to compete with your previous performance to give you and your clients real-time motivation. The ARX uses a computer-controlled motor to give you the exact amount of resistance your clients need 100% of the time. This means that the resistance can never become dangerous, is intuitive and simple to use, and can provide you with all of the results you and your clients are looking for in a fraction of the time. ARX is highly effective and efficient in delivering all of the benefits of exercise, including increased strength, muscle mass, cardiovascular conditioning, bone mineral density, and injury recovery. As well as being utilized by many high-intensity trainers to deliver highly effective and efficient workouts to their clients, ARX comes highly recommended by world-class trainers and brands, including Bulletproof, Tony Robbins, and Ben Greenfield Fitness. To find out more about ARX and get $500 off install when you place an order, please go to arxfit.com and mention Corporate Warrior in the How Did You Hear About Us field. So again, to get $500 off install when you order, head on over to arxfit.com and enter Corporate Warrior in the How Did You Hear About Us field.